Thank you, Representative McDermott and Carl and folks from Abbey and everybody here. It's an honor to receive this award in recognition of the importance of the value of public health work at the local level. And really, it's not about me as much as about what my colleagues do across the nation as well as in Seattle to protect the health of the public. I kind of look back over the last 25 years of my public health career and try to think what are some of the most important lessons that I've learned doing this kind of work. And I think part of it is it's hard to explain what public health is about. And really that's what the Campaign for Public Health is about. So let me give a couple of examples because I also do clinical work. I work at the county hospital at Harborview and see patients there. And I see a patient who comes into my office, say, with asthma. And I can prescribe an asthma medication. And they go home to substandard housing, and there's mold, and there's cockroaches, and the medications don't work. So I can develop a public health program and work with partners where we go into people's homes and remediate the conditions or make sure that public housing is healthy. And then these kids go back to school, and they can play basketball, and their asthma is essentially in control. Or what about all the folks who are exposed to or smoke or are smokers? Well, I can counsel them to quit smoking, but what if they then go back to a public housing unit or an apartment where the next door neighbor is smoking and the secondhand smoke is drifting in? Well, I'm proud to say just this year, we've converted all the public housing to smoke-free apartments in King County, and so nobody has to be exposed to secondhand smoke anymore. So those are kind of some of the examples of where I get really excited about public health and see how if we're really going to make our community a healthy community, it's through these kind of activities that affect everybody as well as what goes on in the doctor's office. So with that, I want to just thank everybody who I've worked with over the years to make all these things happen. It takes tons of partnerships with hospitals, with schools, with clinics, with child care providers, with public housing, and so on to really make a community healthy. And so I'm privileged to be part of that community bringing health to us. Thanks.